Now then, the United Nations says progress is being made to tackle HIV and AIDS, singling out Eastern and Southern Africa as the regions making most headway. Globally, UNAIDS reports that the number of AIDS-related deaths has almost halved since its peak in 2005, and the number of new HIV infections is down 16% since 2010. An estimated 19.5 million people are now in treatment, and that's more than half the total number of people living with HIV. But the picture is not the same everywhere. While 60% in Eastern and Southern Africa are in treatment, the figure for Western and Central Africa is just 35%. And the picture is even worse in Eastern Europe, where just over a quarter of people are in treatment, and new infections are up 60% since 2010. Well, Brian Honermann is the Deputy Director of Public Policy at the Foundation for AIDS Research and joins us now live from Washington, D.C. Brian, welcome to the programme. It's kind of good in parts, this report, isn't it? Overall, what are your thoughts?
Yeah, I think the data about what's going on in Eastern Europe and Central Asia is particularly disturbing, although we've been seeing those trends for some time. I think what we need to do is be looking at how we address particularly the epidemic amongst people who inject drugs in the area. About 40% of new infections are happening amongst people who inject drugs in Eastern Europe, and largely driven by the epidemic in Russia. And so, this is where we need to look at how we get people into treatment, because treatment works as a prevention device for other people. And it's also what keeps people alive. And then we need to look at how we expand comprehensive prevention programs, particularly around harm reduction services for people who are injecting drugs.
Right, and it is drugs use that is driving this, is it?
It is a large driver of the epidemic there, also in line with other key populations in the region, particularly men who have sex with men and sex workers, sex worker clients, and prisoners as well have major burdens of the epidemic in the region. Globally, about 80% of the epidemic is in sub-Saharan Africa, is amongst the general population, but about 25% is amongst key populations. And that picture is much worse globally, particularly in regions such as Eastern Europe and Central Asia.
OK, well, tell us about treatment and treatment in the future. What are the developments in research?
The developments in research, there's some exciting research going on, particularly around vaccines. We have a very good clinical trial, or a very promising clinical trial that's going on in South Africa at the moment that we're really excited about. As far as research on cure, we're excited. amfAR has been putting a lot of investment into scientists looking at how we can find mechanisms for cure and eventually a cure itself. But the big problem, at the moment, those are still uncertain. What the UNAIDS report is talking about is where we are with the epidemic today and what the plan is before we are able to get a cure or a vaccine that will fundamentally change the landscape. And where we are there, I think you already covered a little bit, where just over 50% of the people living with HIV in the world are accessing treatment. But our impact of that on reducing new infections is still limited. I think the report makes clear that a lot of that is driven for globally by the lack of getting people onto treatment early, particularly at young ages, where we see the greatest burden of new infections is hitting young women in particular in sub-Saharan Africa.
OK, very briefly, if you would, AIDS-related deaths almost halved since its peak in 2005. What's your assessment of that figure, just in 20 seconds or so, if you would?
I mean, that's incredible progress from where we are. I've been working in this field for a long time, and it's incredible to have gotten to the point where we've halved the number of deaths in that period of time. I was in South Africa in 2006 through 2010, and we did not expect to see these sorts of results. And now we're there, and that's super exciting. But there's an enormous amount of distance to go. There's about 37 million people living with HIV today. Only about half of those are accessing treatment, and we need treatment to everybody in order to really save lives.
OK, Brian, appreciate that. Brian Honermann, thanks a lot.
Thank you.